Hi, my name is Ellen Scobie and I'm a registered nurse here at SeaMist MedSpa in Rhode Island. And today we're going to do a demonstration of the new product called Voluma. It's a new FDA approved product that is used for aging of the mid-face, and it's a terrific new product. It's going to last for 2 years. I was just trained recently in San Diego, the only person in Rhode Island, so it's quite an honor for me, and I've done several of these so far. So I just want to tell you a little bit about the product. It is a hyaluronic acid, kind of like Juvederm or Restylane. It's made by Allergan, and it is the first FDA approved for the mid-face. So we lose volume as we age, and it creates other issues in the lower part of the face. So what we'll be doing today is actually correcting the reason why we have issues on the bottom part of the face, and we'll go into that in a little bit. So it should only really be done by somebody who's had a lot of experience injecting in the mid-face, so that's really important. And today we have a model that's with us, and we'll be going over exactly what her desires are, and I think it will help explain it a little bit more in detail as I go along. So here we go. So here we have our model, and we're just going to go over a few details. So what happens, and it's not typically, it doesn't have to do with age, but as we get older, we lose some fat volume in the cheek area, which creates the nasolabial lines. So what we're going to do here today is just create a little bit more volume in the cheek area. So for safety reasons, it's really important to mark the face, and I'm just going to mark certain areas. So this is, like I said before, this is not a procedure that somebody should be doing that has not had a lot of experience in doing the mid-face. It really is something that it's for a more experienced injector, so just to keep in mind that, okay? So I'm just doing zones. This is all for safety. Okay, so now she's marked. I'm going to just visualize. Everybody's very different, but I'm going to visualize where we need to put that fill just to give a little lift, bring out the nasolabial line, and some of the etching will be lifted up also. She's got a little hollowing in the eye area, so we'll try to scooch some up in that area to soften that up a little bit. So here we go. Okay, so we're going to start on the upper part of the face here, and she's going to feel a little pinch. Okay, and I'm going to feel a little pressure maybe. Okay, and we're just going to massage that a little bit. How you doing?
Fine.
You okay?
Mm-hmm.
All right, good. All right, and I'm going to do that again. A little pinch. Okay. Don't hold your breath. I know it's a little pinchy. Okay, doing good, beautiful, beautiful. Okay, so as you can see, we're just kind of building up the cheek area, just ever so slightly. Okay, looking good. All right, we're going to do that again, and a pinch. Okay, breathe, easy, I know, a little uncomfortable. Okay, all right, breathe out, Okay, good job, okay. Okay, so now we're going to go into this area here and just lift the cheek a little bit. So I want you to take a nice deep breath, blow it out, That's it, okay. All right. Okay, all right. And you feel a little bit of pressure as it's going in. And that's it. Okay, we'll massage that. Okay, you can see we're just kind of building up the cheek here. I'm going to remove these lines so you can get a good idea. Okay, so now we're going to do the cheek area, and I'm going to have you take a nice deep breath and blow it out. That's it. Okay, now just focus on your breathing, nice and easy, in and out. That's it. Okay, breathe. Doing great. Beautiful. Beautiful. Okay. Wonderful. Just massage that in. Okay, so as you see, if you look at one side compared to the other, the flatness now, she's got a nice curve to her cheek. Just going to hold that. Okay, so now we've done the right side, and we're just going to make sure everything is nice and smooth, all molded in. This is going to last for a couple of years, so we want it to look great. Okay, so let's take a look at her face now. You can see where we've built this up a little bit, where it's pulled out the nasolabial fold. The flatness here has gone away, basically. She has a little lift, so it looks really pretty. And afterwards, when we do a little makeover on her, we'll see the real contour that's back in her face. So now we'll go ahead and do the other side. Okay, so this is the end result. So, Christy, tell us, how did it feel?
Well, being my first time with injectables, maybe a little queasy feeling, but really not that much pain at all. It's just more of a kind of an icky feeling,
Okay.
but it's fine. Once I got over that.
So the pain on a scale of 1 to 10, what would you say if 10 is the worst?
Oh, like a 4.
Okay.
Only on the initial injection. It's
Okay.
not really that painful.
All right. You've seen it. Are you happy with the results?
Yes, definitely.
It's subtle.
It's subtle, but it's just enough to give you that little extra oomph and the little plump in the cheek.
Yeah. Okay.
Yeah.
So I'm just going to go. Just turn your head straight so we can see the cheek area, nice and plumped up. And then turn this way. We'll see the other side. So you can see basically her face, and then just turn again this way to me. Perfect. Okay. So you can see how she's nice and plump in her cheeks, and her nasolabial folds have kind of lifted up. So terrific. Well, thanks for being our model.
Thanks.
Okay.